Good afternoon, everyone. My name is Chengsheng Ju, a research fellow in University College London. I'm here to present our study entitled Emulating a Target Trial to Assess the Effect of Leukotriene receptor antagonists on Parkinson's disease and neuropsychiatric events in patients with asthma. A work led by Professor Thomas Fourtini and Professor Li Wei. Parkinson's disease is a growing public health challenge with no treatment to slow its progression, and leukotriene receptor antagonists, or LTRA for short, such as Montelukast, are widely used for asthma and have shown potential neuroprotective effects for Parkinson's. However, these drugs are associated with neuropsychiatric risk, as highlighted by MHRA warning. While a recent observational study suggests high-dose Montelukast might reduce Parkinson's disease risk, these findings are prone to bias and do not balance against the risk of adverse neuropsychiatric events. To address this issue, we emulated a hypothetical target trial using observational with real-world data to provide robust evidence. Our objective is to evaluate the effect of LTRA treatment on the risk of Parkinson's disease and neuropsychiatric events in middle-aged and older asthma patients. We routinely collect healthcare data from a CPRD, a database of electronic health records in the UK, and conduct a population-based cohort study. We use a technique called a target trial emulation, that is emulating a hypothetical target trial using observational data to improve rigor of the analysis. So in this approach, we conduct sequential trial emulation. This involves 140 trials initiated at 3-monthly intervals for patients aged between 50 and 84 years. Patients were divided into 2 treatment strategies that are initiating LTRA treatment versus no initiation of LTRA. And the outcome of the study included Parkinson's, defined as having 1 diagnostic records plus at least 2 records of anti-Parkinsonian drugs, and neuropsychiatric events that include anxiety, depression, sleep disorder, and psychosis. We employed score matching techniques based on 50 cohorts to minimize confounding, followed by pooled logistic regression to estimate both the intention to treat effect, which is the effect of treatment initiation, and propofol effect, which is the effect of sustained treatment. So analysis included 194,000 patients in the emulated trial after matching. Balance in terms of all baseline characteristics between LTRA initiators and non-initiators. The median follow-up time was nearly 6 years. For Parkinson's disease, we found no significant difference in the risk between 2 treatment groups. In the intent to treat analysis, we found the 10-year risk ratio was 1.09, and in the protocol analysis, 10-year risk ratio was 0.95. The detail of these 2 analyses and results are shown in the cumulative incidence curves. For neuropsychiatric events, LTRA treatment was associated with increased risk of depression and sleep disorder, with around 15% relative risk increase in both the intent to treat and protocol analysis. And we found no significant difference for the risk of anxiety and psychosis. To conclude, our findings suggest that LTRAs do not significantly reduce Parkinson's disease risk, but are associated with higher incidence of depression and sleep disorder. This highlights the need for caution for considering LTRAs for potential neuroprotective purposes. Further research should explore ways to mitigate this risk while evaluating their therapeutic potentials. Thank you, and happy to have any further chat on this work.